people come to me thinking that a facelift is their entire face, but really a face and neck lift is really just going from your cheekbones down to the lowest part of your neck. For me in particular, almost all of my patients, if I'm doing a facelift, I'm also going to do a neck lift on them. So a facelift is a surgery where I make an incision around their sideburn, down around their ear and back into their posterior hairline, and also a small incision under their chin. So through that small incision under their chin, I can really address the aging of the neck. And then through that incision around your ear, I'm doing a deep plane facelift. So I'm getting under that layer of tissue where the muscles are sitting and kind of traveling in that area where the nerves are. But by lifting that deeper tissue, I can put all the stress on that deeper tissue and reposition those muscles and those ligaments. So that's a pretty big operation, and you're seeing a lot of change in the patient's facial shape and their facial structure. That surgery usually takes about 4 to 6 hours to do. So it's a pretty long operation. I usually like to keep you in the hospital one night. You typically have drains, one on each side of your neck, that'll take out the first day after your surgery, unless for some reason we decide that we need to keep them a little bit longer. You usually go home the day following your surgery. That first week after surgery, I really want you to lay low. The only thing I want you to do is really walking around the house 5 or 6 times a day. You're trying to eat a soft diet. I don't want you moving your neck a whole lot. You're gonna look pretty bruised for about 2 weeks after that surgery, but after 2 weeks, I have all those sutures removed. And then usually you can put on a little bit of makeup to cover any remaining bruising and go out to eat without anybody noticing that you've had something done. I'd say the majority of patients, anytime they're seeing that facial aging, they're also seeing it in their neck as well. So I think if you're gonna go through a facelift, I should just go ahead and address the neck at the same time because it creates a more harmonious result from top to bottom.